healthcare emergency in our country, and especially in communities like mine. I come from the California Central Valley, where there are 350,000 people, even today, who still lack health insurance. And during the first 100 days of office, I've been doing a listening tour across our district, and I've heard the same thing come up again and again and again. We need to do something about the cost of healthcare. In our community, premiums are rising. The cost of prescription drugs are rising. But the quality of care just is not keeping up. I made a promise to the Central Valley that I'd do something about it. And today we're taking the first step towards fulfilling that promise. We're taking a step to make sure everyone has access to health care and that it's affordable for each and every family. This is uniquely important in a community like mine, where unemployment is twice the national average, and where far too many people just don't have jobs that provide health care. People like Olga from Modesto, who I met last week. She has an $800 a month bill for dialysis, even though she has health care. A couple days ago, I talked to Sergio from Turlock. This is a guy who has health care, but is waiting over 9 months to see a specialist to understand why he's having trouble breathing. These are the real life consequences that we're addressing here today. Because I've heard again and again from people that on the day they receive their Medicare card, they break down in tears because they realize what it would meant to have a consistent access to health care. That's not right. In our region, Medicare is the only part of our healthcare system that actually works. So today, we're keeping a promise that nobody should have to make that choice between paying for medication or paying for groceries. That nobody should have to make a decision between going to the doctor or going to school, between saving for emergencies or saving for retirement. This is the first step to making sure that all people in our community can live with dignity. Thank you to my colleagues here today, and thank you so much for Camilla and Debbie for your leadership. I look forward to working with you and our stakeholders to deliver on the promise for health care for each and every American. And that path starts now. It's my pleasure to introduce my colleague, Chuy Garcia, who's been a wonderful public servant for the city of Chicago, where I think this weather is considered to be warm and summery. Exactly. Thank you. Thank you, John.